Hi everyone. A lot of questions came in after my last post about cutting boards. Many of you were asking, so what do we use instead? Well, the answers to all your questions are in this video. Kindly share so others can learn and stay safe too.
Use your elbow to clean your ear. I'm Professor Olushola Abdurrahman Afolabi, a professor of ear, nose, and throat, and a consultant ENT surgeon with University of Ilorin Teaching Hospital, and the medical director, Triple Sense ENT Specialist Clinic, that is located in Atinuke House beside Okin Petrol Station, Ilorin. Of course, I know using elbow to clean the ear, it's not possible. It's just a way of discouraging them from inserting anything into the ear. Because using cotton board to clean your ear, sometimes you can push the wax from where it is produced into the part that does not produce wax and does not have facility to clean the wax. And that continue to build up wax, and that can block the hearing of that individual. Sometimes using that cotton board, the head of the cotton board may get dislodged into the canal, and that becomes a foreign body in the ear. And as a foreign body in the ear, you have to present to an ENT surgeon, which is, I usually play or joke with my patient that you have invested. You bought a cotton board for 25 or 50 naira, and you are removing it with thousands of naira, which I think is not a wise investment. Also, using cotton board, the process of using it sometimes is very soothing, but you are creating some micro injury. What I mean by micro injury are small injury with minimal bleed. And when water gets in there, the water gets absorbed. The place gets swollen. Sometimes they get infected with pus from the air. And the external air, based on the boundaries, is also very close to the brain. Then some of this may also cause pain, severe intense pain for that patient, and may prevent the patient from having a good sleep overnight, especially when it happens in the night. So that patient will have to present to an ENT surgeon or to a doctor for it to be managed. Then some of this cotton board, in the process of cleaning, if somebody accidentally hits your elbow, can push the cotton board inward, and that can damage the eardrum, which we call the tympanic membrane. And when this is damaged, that affects the hearing of that individual, which may lead to what we call a conductive hearing loss in that individual. Those are some of the few complications that the cutting board can cause. So how do we clean the ear? I usually encourage the patient that when your ear is itchy, you can put your hand in front of, this is what we call the tragus. You can put your hand there, rub it gently. When you rub it gently, that soothes the hearing. It soothes the itching, and you feel much better. Or you rub behind the hair like this. When you rub like this, that also reduces the itch. Or when you have excess of those wax coming out, you can clean it, or you insert your finger into it, but not inserting anything into the ear. So sometimes when this wax builds up and you present to an ENT surgeon, what we usually encourage is you can start applying olive oil. Sometimes we prescribe serum. You apply it into the ear. That will tend to dissolve the wax, so that by the time you are presenting back to an ENT surgeon, we can flush out the wax. And sometimes when we check, there may be no wax inside the ear, but the patient may still continue to have itchy ears. So what we do is we encourage them to apply olive oil into the ear. That will get the external auditory canal wet, and that sometimes reduces the itchy. But when the itchy is systemic, that is affecting the eyes, affecting the throat, affecting the skin, then you have to place that individual on a systemic anti-allergic medications. So the other one that you apply the olive oil when it is localized is when you apply the olive oil there, that tends to soothe the canal. In such situations, just like during the harmattan, when our skins are dry, wax rub a cream or Vaseline on it, you tend to feel better. It's the same principle that is applied to this dry external auditory canal. The more you itch, the more itchy it becomes. The more you try to rub it, the more itchy and painful it becomes. So the habit of self-ear cleaning is discouraged. Well, the wax, sometimes it happens, it affects all age group. The children, the young, the adult, as well as the elderly. In the young, the children and the adult, they tend to have a soft wax with increased body fluid. That wax may continue to flow out and you clean it. But in the elderly, because of their low water content, this wax tends to build up and tends to get hard. In such situation, they may present with repeated wax impaction. And when they present to us in ENT clinic, we encourage them to apply olive oil, apply serum oil, get it softened, and we flush out the wax from these ears. So when you have this repeated ear itch, feeling of fluid in the ear or feeling of water as in your ear, or you have blockage of your ear as a result of wax impaction, don't just start using any of this medication, either olive oil or serum oil. The advice I will give is you present to the nearest ENT surgeon. If you don't have any ENT surgeon, see a doctor who will direct you to an ENT surgeon for proper assessment of your hearing, and treatment will be applied. Thank you.